Life is full of ups and downs, and sometimes you wake up on the right side of the bed. And sometimes you don't. Sometimes you feel like you're on top of the world.
Hey Duncan, how are you?
Hey, what's up, Nicolette? How you doing?
I'm doing pretty good. What has you in such a good mood?
You know, man, school's coming to an end. My grades are great. And I get to go home. I've been there 4 weeks. So things are pretty much on the up and up.
That's great. I'm gonna go back to my room and relax a bit. So I'll see you later.
Hey, I'll see you.
Bye.
And sometimes you don't.
Yo. Dude, can you not?
What? I'm just
I'm
playing.
just sitting here on my phone. I'm not trying to listen to that, bro.
Can you just like put in earbuds or something? Like,
Oh, if I want to put in earbuds, I'd put them in, but...
dude,
Come on, dude.
I'm just playing. It's like nothing.
No, dude, I don't want to hear it right now.
Fine. Sorry. Dude, come on. We're going. They're all over there. We gotta go. You haven't been out in weeks, dude. Let's go. Look at this. This is a mess.
Get out of here, bro. You sure?
All right, man.
That's it.
Sometimes your all-time low is recognizable.
Hey Duncan?
No.
Hey, what's up?
Oh, you know, not much. Just been really grinding out the project for farm.
Really? The one that was due last week?
It was due last week?
Yeah.
Oh, dude, I've been spending all my time on it.
Listen, I've been really worried about you. Do you mind if I come in and we can talk?
Yeah, it's fine.
Okay. What's up?
Not much, man. I'm just kind of going through it.
You know, I saw you the other day and you looked pretty stressed.
Yeah.
Just so you know, I'm here for you.
Thank you. You know, thanks, Nico. I really appreciate it. This whole semester's just been weighing down on me. It's been really brutal.
Yeah, I'm glad you feel comfortable talking to me about it. There's no shame in what you're feeling. Just, you can talk to me about anything.
Yeah, it's just been, I'm starting to get concerned that it's not just this semester that's been doing it to me. It's like this deep hole in my chest, and it's just like I've been trying to fill whatever I can, but it just feels like it's getting more and more. And I spend all my days either sitting here in the dark, my roommate's suffering, he's been getting on his case for no reason, and it's my fault. But I don't know, I can't feel like I can get past this feeling, and it's really tough. I spend most of my days on the bed just looking at the ceiling. It's brutal.
You know, Duncan, I've felt the same way.
Really? What'd you do to help?
You know, I realized I really needed to get help, so I went and I got a prescription for Lexapro, and it really helped me.
Lexapro?
Mm-hmm.
I'm gonna look into that. I appreciate it.
Mm-hmm.
Depression is defined as a mood disorder that causes a persistent feeling of sadness and loss of interest. A lot of people know about depression, but what it does and how it can look is far less known. There are a lot of myths and misconceptions that can make it hard to ask for help. What if I'm faking it? What if it's all in my head? What will my friends and family think? These are just some of the questions that a lot of people struggle with. Anyone can have depression, and it sometimes goes unseen or ignored. Depression does not manifest in one singular way, meaning that people with depression can display a variety of different symptoms. However, it is important to know that playing a sport, staying active, or just having a good day are all things people with depression can experience. None of these things should dismiss a person's concerns because depression is a persistent sadness, not a constant sadness.
Okay, so you know what, Duncan? Based off of some of the things you were telling me today, I think that you do have depression, and we got 2 ways to manage that. So the first one being some non-pharmacological ways, and that could be kind of some self-care, so taking care of yourself, sleeping good, exercising right, as well as eating well, and then setting some goals, some aspirations for your future is huge, and some therapy could also be a good idea. But I also do think you need a little more help, a little more boost, and that's okay, that's normal. So I think we're gonna get you started on some Lexapro. Don't know if you've heard of it before. It's also known as escitalopram.
You know, thanks, Doc. I appreciate it. I had a close friend tell me to use it, and they said they had great results.
Yeah, well, that's good.
Doc, you're a pro. Lexapro. Good vibes in here. You know what I mean? That's what I'm hoping for. Nuts, brother.
Dude, what's going on?
Dude.
How are you, man?
Doing all right, man.
Good to see you.
Dude,
Are you ready to go?
I'm ready.
Everyone's out there waiting for you. They all keep talking about it.
For me?
Yeah.
Come on. Let's go, man. Let's get out of here. Oh, let me get my shoes, man.
Hey,
My bad.
think fast.
You're a stinker, dude. Let's get out of here.
Yo, Duncan!
Dude,
You look so good!
man, I'm feeling great.
That's
I met
fantastic.
with the doctor, got the Lexapro you were telling me about. Dude, I've never felt better.
It's amazing, isn't it?
Changed my whole aspect of life.
Mm-hmm.
I feel good. I'm doing everything right. Not distracted. I'm
You
not.
look good too?
Come on, you're making me blush. But hey, I really appreciate it.
Thanks.
Lexapro is a selective serotonin reuptake inhibitor, or an SSRI. This means that it is a medication that allows for more serotonin to be available in the central nervous system. It is used to treat major depressive disorder, generalized anxiety disorder, obsessive-compulsive disorder, or post-traumatic stress disorder, and more. Onset of this medication is 1 to 4 weeks. The most common dose is 10 milligrams once daily and may be increased to 20 milligrams after 1 week. Administer as a single dose in the morning or evening without meals. The patient is instructed to take Lexapro exactly as directed, remembering to take missed doses and seeking medical advice when necessary. The following day, the patient should resume regular dosing and refrain from stopping suddenly. Until the response is known, the patient should refrain from driving or engaging in any activity requiring alertness because this medication may cause dizziness. The patient is instructed to be on the lookout for thoughts of suicide. particularly during the early stages of therapy or when the dosage is changed, and to contact the healthcare provider right away if they experience any of the following symptoms: depression, anxiety, agitation, panic attacks, insomnia, mania, irritability, aggression, or other changes in mood or behavior. The patient is also advised to consult with a healthcare provider before taking any additional prescription, over-the-counter, or herbal products, particularly St. John's wort, alcohol, and other CNS depressants. The patient should also disclose to the healthcare provider all vitamins, herbal products, or over-the-counter medications that they are currently taking. If a female patient is planning a pregnancy or is pregnant, she should let the healthcare provider know. Potential/common side effects: sweating, diarrhea, nausea, abdominal pain, constipation, dry mouth, indigestion, decreased libido, delayed/absent orgasm, ejaculatory delay/failure, erectile dysfunction, increased appetite, neuroleptic malignant syndrome, suicidal thoughts, insomnia, dizziness, drowsiness, fatigue, serotonin syndrome. Contact your healthcare provider now if you experience suicidal thoughts or symptoms of serotonin syndrome, which include low heart rate, disorientation, muscle tremors, flushed skin, and more. This medication has a black box warning because of its increased risk of suicide. If you have any questions, contact your healthcare provider now. Don't let life pass you by. Be a pro and try Lexapro.